If you've experienced pelvic pain, you know how uncomfortable it is and how it can be seen as something shameful or even embarrassing to talk about. Pelvic pain is different than other types of pain because if my knee hurts, I would be able to talk to people about it. But if I'm having vaginal pain, I usually wouldn't tell other people about it because it's so personal. And sometimes it can be seen as embarrassing, shameful, and that can make it really isolating and actually make the problem even worse. Pelvic pain can present in a lot of different ways. So it can be pain with intercourse, pain with using tampons, pain with wearing tight clothing, pain with sitting, and the list goes on. 1 in 7 women will experience pelvic pain at some point in their lives, so it's actually a lot more common than we think. Let's talk about some anatomy and reasons why pelvic pain might happen. So we have our pelvis with us. These are our hip bones, this is our pubic bone, and this is our tailbone. Our pelvic floor is the group of muscles, ligaments, nerves, blood supply, everything in this area. We can experience pain because of nerves. We can experience it because of muscles being too tight, or it can be from organs like your bladder or your GI system or your uterus or fibroids that are in this area. But it doesn't matter what the reason is because the feeling is the same, and it causes one root issue where when we're in a lot of pain, our pelvic floor muscles will really tense up. Pain is a normal part of the human experience. If we didn't experience pain, we wouldn't be alive. And pain is not a bad thing. Pain is our body's way of saying, hey, something's going on that you need to pay attention to. I want us to first reframe pain, taking it from something that means we're being harmed to our body's way of saying, hey, there's a threat here, you need to pay attention. So I like to think of pain like my Honda. When I had a Honda, the car alarm was so sensitive that if someone drove too fast, the alarm would go off. And this was in college, and my friends would text me like, your car alarm is going off in the garage again. And there was nothing I could do about it because it was a really sensitive car. We're the same way. When we've experienced pain for a long time, so if it's been months, years of being in pain, our body becomes more sensitive. So if before the alarm would only go off when someone was breaking into the car, now it goes off at someone driving by too fast. So if before you'd only be in pain if you had deep penetrative intercourse, now you might not even be able to put in a tampon, or at initial insertion you're in a lot of pain, or you can't even sit without being in pain because your alarm system has gotten so sensitive. The good news is there's a lot of research about this, and we can decrease how sensitive our alarm is so that we can increase that threshold of the things we're able to do. Think of being in pain like being chased by a lion. If a lion has been chasing you, your heart rate goes up, your blood pressure goes up, your muscles contract because they're trying to help you get away from the lion as fast as possible. It's the same thing. When we've been in pain for a long time, our body doesn't know the difference between you're being chased by a lion versus you're experiencing pain. And so for months or years now, your body has been operating under fight or flight mode. So it thinks a lion is chasing you. Now, the good news is we can change this through physical therapy, through exercise, through changing some of our habits and self-care. It doesn't mean it's going to make the problem completely go away, but it will help it. Of course, the best way to get treatment for this is something that's personalized for you, but these things can help tell our body, hey, we're safe, we're not being chased by a lion. People that have been experiencing pain for a long time notice a lot of changes. They notice their sleep might be interrupted, they may not be losing weight the way they think they should be, even if they're eating right and exercising and doing all these things. They may have more mood swings or have difficulty with focusing. And these are all part of a normal response, because if you were being chased by a lion, your body doesn't care to get enough sleep or to focus on certain tasks. It's trying to do its best to survive. There was a study done to show that when women experience threat, so they showed all these women a threatening movie, and when they saw it, their pelvic floor muscles tightened. I bring this up because sometimes we don't know why we're in pain, but we have a lot of stress in our personal lives, or we don't feel safe in our own bodies. And that can be a huge factor in why we're having pelvic pain, because our body thinks we're under threat, so our pelvic floor muscles tighten up. And it makes sense because this is the center of our body. It's a very vulnerable area. It's where all your organs are. So your body's so smart, it tries to protect it by tightening everything up. But this leads to pelvic pain. And the inability to relax these muscles or feel safe continues that cycle. Okay, so what do we do about it? If you're experiencing pain, there's a few small steps I want you to add to your routine. 1, start walking outside. Get away from your house where you might be a little bit more stressed, or your work or whatever it is, and take a walk outside. Start small. You can even start with 5 minutes each day, 10 minutes, and work it up to 30 minutes. There's research that shows 30 minutes of a brisk walk can help with improving your mood, bringing more blood flow to the area, decreasing pain, and improving even your appetite and the way food tastes. So walking is going to be number 1. The second thing is start by doing something you enjoy. So it can be coloring, painting, playing tennis, reading, dancing, whatever it is. Add these little moments of joy into your routine, whether daily or weekly, so that you have something you actually love doing and you're looking forward to. Third, let's start doing mindfulness. So mindfulness can look different for everyone. You can meditate. You can focus on 2 minutes a day of just deep belly breathing, and all you focus on is your breath. You can journal or read or pray, whatever it is. Take a few minutes every day to do something mindful. Just 1 to 2 minutes can make a big, big difference. Other things would be making sure you're getting enough sleep. So 7 to 9 hours of sleep will be really helpful in helping your body recover and feel safe again. And food. So eating nutritious food that's healthy will be helpful as well. I hope this helped you understand your pain a little bit better and give you some small tips that you can start to improving how you feel. I have other videos where we go through exercises that can help with pain and more information on your pelvic health. So subscribe or check out my other videos so you can learn more.